Hey everyone, it's Janelle. Have you ever gone to the emergency room and had to wait several hours in the waiting room just to be seen? Were you wondering, what's going on back there? Am I not an important patient to be seen? Are they ignoring me? Have you or someone you've known ever had to wait more than a day in the emergency room just to be admitted to the same hospital because of a no bed status? Have you or someone you've known ever had to wait several days at one hospital just to be transferred to a different hospital because of a no bed status? Over the past 3 years, I've worked in a small community emergency room where I've seen these problems on a rise. And this no bed status that they're talking about is not because there's absolutely no beds available, but because there's not enough nurses to staff those open beds. I'll give you an example. If there's a 20-bed unit in a hospital and only 3 nurses are able to staff that unit, and the 3 nurses can only take on 5 patients safely, that sets up the unit to only be able to take on 15 patients. That leaves 5 open beds available that if there was one more nurse, those 5 beds could be filled with new patients. So my question for you today is, have you ever been affected by the nursing shortage? The United States has been struggling with the nursing shortage for the past few years. The nursing shortage is from all these registered nurses beginning to hit that retirement age, and they're deciding to retire. But this is happening just as the baby boomers are beginning to need more medical attention. To put this into numbers for you, the United States would have to train 1 trillion new nurses to fill all the vacancies and keep up with the demand. So what are the problems stemming from this nursing shortage? The lack of nursing instructors, the lack of nursing student slots, and the competitive applicants trying to get into nursing school. So why are there a lack of nursing instructors? For one, the hospitals are pretty competitive with their wages. For example, if you're a registered nurse, you could probably make more money working at a hospital than being an instructor. So with the lack of nursing instructors, there's a lack of nursing student slots. So with all these applicants and highly qualified applicants, it's making the nursing school world highly competitive. So what are the fixes to these problems? Competitive wages for instructors, an easier process to get into nursing school, and starting to get those nursing students to have experience in hospitals early. So obviously, nursing instructors need more competitive wages, or at least more benefits or better benefits to pull those nurses out of the hospital and get them teaching new students so that we can get in there and help take care of the baby boomers. There also needs to be an easier way to get into nursing school. At my school, I'm in a 2-year program, and one of the ways they're helping with this is having LPNs, which have taken education in the past for nursing, but are not registered nurses. They're letting these people start at a higher grade level, like the 2nd year. Also, people with military background are able to start at that 2nd year as well. So, they don't have to start out at freshman, and they're skipping an extra year so they can graduate earlier. And then starting to get us nursing students into the hospitals. If we're getting into the hospitals earlier, we're going to have more experience, and once we become a registered nurse and get on the floor, we'll have that experience to take care of those baby boomers effectively. So what are the outcomes to all this? More nursing instructors, more nursing students, and the baby boomers will be taken care of. So the more instructors we have, the more student nurses we're going to have, which makes more new nurses, and those baby boomers are going to be taken care of. So what's going to happen when the baby boomers are gone? Well, the drug epidemic is beginning to hit the United States, and a lot of these people are beginning to hit the hospitals and needing more medical care as well. So all of our nurses are still going to be needed in the future. Thanks for listening. I hope you've learned something, and I hope you have a great day.